Hi, I'm Jen Nutley. I'm the nurse manager of the ER here at Chestertown, Shore Medical Center in Chestertown. I want to welcome you to your new ER and show you around a little bit so you have some ideas of what the enhancements have become with the new space. As you come in, this is the new ER entrance. We've never had a separate entrance for our emergency department, and this is huge because when people are injured, they shouldn't have to meander their way through visitors and other staff. So this is a perfect example of another enhancement that seems very small but very important for us. The main entrance is right next door, so if someone were to come in the wrong entrance, it's really close by. We can get them over to the space as rapidly as possible. This is the new waiting room. Unfortunately, right now that we do have a little kids section over here where the ladder is, it hasn't arrived yet, but we're going to have a small little table and a pediatric area for children while they're waiting. So we're doing our best to improve those times, and that's one of the ways we're going to be doing that. So once you enter through the doors, all the little alcoves that you'll see as we walk through have equipment that's assigned for those areas and are in the appropriate location so we can get to them rapidly as needed. As you come down the hall, first thing you notice probably are some televisions, or what you would notice televisions up in the hallway. These are actually our patient monitors. This is so I can watch cardiac monitoring, or any person working in the space can see the cardiac monitoring of the patients at all times. They're in a few spaces in the area, including the break rooms of both the physicians and the nurses, and all the hallways, and along with the workstations. Immediately to my left are two rooms that we do call the triage rooms, but they are set up so they can be utilized as patient rooms as well. Again, we will use triage bypass, so we'll be passing right by these rooms unless we are over our population or the amount of rooms we have. We're going from an 11-bed ER to an 18-bed ER. And if any of you have ever been to our ER in the past, we had a lot of curtains for privacy. As you'll note now, as you go around, that each room is private. There's only one bay, and that's our trauma bay that has a room for 2 beds, and that's for the purpose of trauma. If we were to have 2 traumas at the same time, we need to have a physician close by, so that's the purpose of this. This room has a unique door, and this is because it is our negative pressure room. In layman's terms, that means that if someone has a respiratory or any type of infection that we don't want to share with the rest of the population, they can go in this room, and it has special ventilation to keep that just to that room. These front rooms, you'll note, have windows. That might seem like a small thing to most people, but those of us who've worked in this ER for some time, we never had any windows. That's huge to see the light of day, as well as for the patients. These rooms are set up just like inpatients with full bathrooms, including showers, so that if we needed to keep a patient over a longer time, for example, cardiac markers, someone needs to wait 8 more hours, they have a much more appropriate room. Or if they need to stay overnight for hydration or something simple, then we can keep them here in the ER and they don't have to go from room to room or even be transferred to another location. So as you go through, you'll notice it's a sort of a nautical theme. We do a green-blue as you go through, and the floor is what's called a soft floor, especially done for our the legs of the staff who work here. It has a little give to it. And it helps everyone, including patients and families. This room here is the only room in the front that does not have a restroom. We stole that restroom for another specialty room that I'll tell you about in just a minute. But this is our bariatric room. We have an overhead lift for those cases where we really need to utilize a lift process. Here's the final room that is for overnight. And then this room in the corner behind me is one of our specialty rooms. It's our OBGYN, our female or women's room, but it's also our SAFE room. SAFE stands for Sexual Assault Forensic Examiner. We do those cases here, and to our great fortune, I guess, there's not many here at our facility, but I am a forensic examiner, and we need more space. We need that room to be private. We need room for detectives to come in and out, for patient advocates to come in and out, for family, and we need that person to feel that they have privacy. This room is not very far from our ambulance entrance, and then once the patient goes in there, there's a restroom and a shower for their convenience as well. So it gives them that extra privacy that they need. Then our next room is our linens, which we need everywhere, and then 2 more bays right here. Straight ahead, I know this is where your view is. This is our trauma bay, so we can walk over there. As you walk over, you'll notice that we have an outside space that a nurse or physician could work here and still keep a visual eye on the patient. Sometimes the family needs some privacy, or it's good to step out but still keep that eye on that patient. So we have a little system here, and then if needed we can also close these off, maybe, so that when there are those big cases, and you know how human nature, we all want to take a gander. Again, I explained that this is a trauma bay, so it can be used for 2 patients or for 1. If we have a very large case, We can just use one bed in the middle and have a lot of room for all the staff to get around the patient that need to be, or we can use it for two in the cases we've had a few large trauma cases and the weather's down and we can't fly somebody out and we have to take care of them right here. I've mentioned before in some other publications that the ER isn't really gaining any capabilities. We're improving by technology, and I want everyone to know that we can take care of everything we've always been able to take care of, and we can take care of everything just like every other ER in the country, except that when we recognize our limitations, say we have a STEMI needs to get to a cath center or we have a stroke, we can do the initial things just like every place in the entire country, and then we can get them rapidly to where they need to go, which is hugely important for our community. Now we have one last hallway that has 6 more bays in it. We may eventually utilize this for a fast track for those cases where we can turn them over more rapidly, orthopedic or possibly sore throats, colds in this area. So there's a possibility here. Again, note we have the cardiac monitoring in this hall, so there's always a visualization of all the patients. A couple more specialty rooms down this hall. I want to tell you the very last bay, room 18, is our behavioral health room. It's kind of set up purposely. If you'll note, this hallway is actually right from where we entered the building. So if we were to have a violent patient or possibly a very depressed patient who doesn't want to be around others, they can come straight through this hall and right into our quiet room. It makes a lot of sense because they don't have to have visualization of other patients. The room is set up for all levels of behavioral health. It's set aside to keep quiet, but it's also there for those cases where we possibly could have someone who's violent. We have the special drywall in this room, special glass, and we also have a bathroom behind a closed door and what our medical gas is behind a closed door. So for those cases we really don't need the patient to come out into the main population. We can keep them in that room and take care of them as best we can. Down this hall, there's a lot of those things you really don't need to hear about in the ER, but there's one really important room I wanted to make sure everyone knows about is that consult room. If you've ever been to our ER before, it was very small. There was no place for the physician to go talk to anyone or possibly pastoral care. So now we have a space called a consult room. So when a family has to have some private time, they're working in here right now, but you can take a gander. Or if they need to speak with their pastor or maybe palliative care, or need to hear something from the physician, there's some quiet time, space away from everyone else. Right off from the main workstation that we've been calling the team workstation is this physician consult room. This is a great space for the physicians because often they need to speak quietly with a family or another physician about a patient's care. This is what this room is set up for. This also would include the physicians in our community who need to come and work with the patient here. They have a workspace too that is quiet as well. That we have an EMS room, which is wonderful because before we didn't really have a workspace for EMS. They were sort of in a hallway. Now they have a workspace where we provide them with all of the supplies or a lot of the supplies that they need free of charge, as well as have what's called a Pyxis machine, which is a system for them to obtain medications that they use on the patient and replace them. And then that again we do free of charge for community service. So that's great for our EMS staff that come through. They're really part of our team, so we make them feel as much at home as possible while they're here. One of the best upgrades to this area is that we have this very open workstation. We're calling it a team station because all of the necessary disciplines can work out here together. It improves communication, helps for the patients because we have a visualization of almost all of the patients that we need to see at all times. Case management can work out here, social work, the physician group, physical therapy, nutrition, whoever needs to come down and work, nursing, can all work in this one station together to make the best outcome for the patient. For 2 ambulances to pull up at the same time. One of the complications with ambulance when they pull up is that they often have to leave their vehicle running because of the different equipment that's in there, especially the trauma ambulance that comes. So we have given them the ability to ventilate as well as to hook up to electric while they're here, which is hugely important, as well as added an air curtain for the staff so that those fumes could stay out in addition. Also, one of the huge upgrades in my opinion is that we've added a specific decon area. In the past we had basically a shower outside, but now, especially with the fertilizers in the area, the chemical companies we have around here, we really need to think of decon as important. Even though it's very rare, it is very important when it does happen. So the decon area starts here. A person who is positive or hot would come in through this wall, and I'll walk in here through this other area, which includes EMS work area, to an area that's specially ventilated and specially drained for just that purpose. So patient would come in from the door that we saw on the outside, in through, become neutral, and leave cold.